of 2021. So I went ahead and just put in the chat a little note asking you all to join me. Go ahead and put your name and where you are joining us from today. And then we'll get going momentarily. And then I'd also just like to add that once we start our program, we're going to be recording it so that we can use it for future educational opportunities. Wow, this is great. We have people from all over in a whole variety of different organizations, different places in the state. So, again, we're super glad that you're able to join us today. And with that, I think we want to go ahead and kick off our program. So, I'd like to introduce the president and CEO of the Idaho Community Foundation, Karen Billowith, to give us a welcome.
Thank you, Kara. Wow, it's so great to see so many familiar names and faces for those of you who are on video. I miss all of you, and we're looking forward to the day in the not too distant future when we start to convene in person again. However, I will say, Kara mentioned that this is our first of our virtual learning series for 2021, but we had several last year, and what we found was in the virtual environment that we actually got great participation from around the state, and people gave us the feedback that they appreciated the opportunity to share across the region. So that was a silver lining of the pandemic that we discovered in terms of engagement with some key groups. So I am just really thrilled to have this opportunity today to have our first learning series on the social determinants of health. And as I think many of you already know, is over the past several years, the Community Foundation has done many different activities to start to learn about the needs across the state in Idaho to help inform our own grant making, but also to foster communication and collaboration in addressing issues across our regions. And it started with a series of community conversations. We also had we supported and participated in some community health assessments, including one with the Blue Cross of Idaho Foundation for Health. We looked at the United Way ALICE reports, and through all of that effort, we identified 4 areas of impact that are helping to inform our work. And those are housing and homelessness, mental and physical health, educational opportunities, and access to services. And I'd like to point out that while we talk about them as identifying these areas, it was really community-based processes that identified these for us. So we didn't determine what they were. We heard that these were areas of important challenge and opportunities across the state. And then last year, when we saw what was happening during the pandemic, and especially through the COVID fund grant making, we saw that all of the challenges related to these areas of impact were compounded, and that they really were concentrated among those who were in the ALICE population, seniors, people living in rural communities, and a few other specific populations. And also, what all of you on this call or this video know as well is that they're all related and intersectional, and they all connect to what we'll talk about today, which are the social determinants of health. So I'm really thrilled to introduce Kendra Witt Doyle, who is the executive director of the Blue Cross of Idaho Foundation for Health. I'm sure you're all familiar with that organization and all they've done across the state. Kendra Kendra, and I'm sure many of you know Kendra, but she is a first-generation college graduate and holds a Bachelor of Science degree from Boise State University, a master's in public health from University of Texas School of Public Health, and a PhD from University of Texas, El Paso. So that is her background, but I'm sure you all know that Kendra also knows so much about Idaho and Idaho communities through the work that they do at Blue Cross of Idaho Foundation for Health. So she is going to talk today about a report that they just published, focusing in not only on social determinants of health in Idaho and connecting that to some community needs data, but also what opportunities exist for all of us to come together and collaborate to make Idaho a better place, which is why we're all showing up today. So thank you in advance for your participation. Thank you so much, Kendra, for your time. And I am going to turn it over to you.
Thanks, Karen, and thanks everyone for showing up. It's so great to see so many familiar faces. It always makes me realize how, as much as Idaho is growing, we're still connected when I can show up on a Zoom call. And I still see at least half of you that I know, which still makes me feel at home being an Idaho native. I'm like, oh, we're still Idaho, right? Even with all of our growth and change. So thank you. I'm really honored to be the first presenter this year. And I'm excited to present this report to you that we did. And I'm also going to be standing because I'm used to giving presentations standing. So if I'm pacing and my head's bobbing, I'm sorry. I have to stand to do this to at least have some non-Zoomness to a presentation. I'm going to share my presentation now. Can I get hosting capabilities? I'll switch over here.
You should have them, Kendra. Is it not letting you?
No, it says host disabled participant screen sharing.
I'll reclaim it and give it back to you.
Okay.
So in the meantime, I will just throw out there, please put any questions that you have into the chat and we will go through and address them at the end. And, we all welcome and love questions. And I know Kendra would be happy to answer anything that you have on your mind. So.
Yeah. Definitely. I am going to hit slideshow start. Okay. So before I dive into this report that we had commissioned, I wanted to back up. And I know a lot of you have probably seen the cliff analogy. I love the cliff analogy. It's a place where I actually want to start. So this is the cliff of good health that was actually developed by an individual at the CDC. And the cliff of good health talks about what happens when someone has a negative health occurrence, right? This could be diabetes, maybe it's a heart attack, but they're on the cliff of good health and they fall and they come to the bottom of the cliff. What happens when we get to the bottom of the cliff in our current system? Well, generally we have an ambulance that shows up that tries to kind of put Humpty Dumpty back together again, right? So we have some type of access to health care to try to help, right? Well, how do we prevent someone from actually falling and hitting the bottom of the cliff? What things could we do? Well, we could put up a safety net to help catch people, right, to where they don't hit the bottom of the cliff. However, sometimes, I don't know if you see my cursor, sometimes nets still have holes and people can fall through these nets and still hit the bottom. We could put up a fence to try to prevent people from falling off, right? A fence in the first place. The thing that we see though is even with fences, sometimes populations come and they butt up against that fence. So what we want to try to do is back people up as far as we can from the fence. But the thing that we see in communities is that not all are equal, right? Sometimes there's differences in exposures, differences in access to care, differences in the quality of care that all impact this cliff, either how quickly someone falls off, where they get caught, or even what type of services they get when they get to the bottom of the cliff. So not all communities are the same. And there's actually a lot of research out there that shows that our zip code predicts our health more than our genetic code. So where we live and the things up here, the differences in exposures and opportunities impacts or accelerates how quickly individuals fall off that cliff and where they land on the cliff. So what is this? The bottom of the cliff, the ambulance, is medical care or tertiary prevention in my wonky public health hat. The net is safety net programs or secondary prevention. The fence is what's called primary prevention. And trying to back people up from the cliff is addressing the social determinants of health, right? So what are the social determinants? They're the conditions and environments in which people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes. There's a couple different models. The education, social and community context, neighborhood and built environment, access to care, and economic stability are usually kind of the common five that we heard talked about. I actually don't love this graphic because it makes you think that each one is silos. And they are not silos. Each one of these are extremely interconnected, and I actually like to think of them as cogs on a wheel. If you turn one, the others are going to turn as well. You can't necessarily treat one without understanding all the others, and we have to really understand the system of social determinants of health to impact them, or to focus on that top of the cliff, and where are we going to work at the top of the cliff to prevent people from falling off. So the Blue Cross of Idaho Foundation has been really dedicated to addressing the root causes to health outcomes, or the social determinants of health. But we really wanted to take a pause and better understand this across Idaho to see what was this looking like. So we actually commissioned a report called it ended up being called Building a Healthy Idaho Report. It was a group called FSG that actually put this report together. And we decided to not just make this a very internal report for us. We decided for it to be an external report, that even the opportunities that I'll talk about in here were cultivated and came out of a meeting with a whole bunch of stakeholders. Idaho Community Foundation was one of them, that they talked about what was happening around the social determinants of health and where are there opportunities in Idaho to address these. So I'll be talking about that a little bit more. So what was the process? So we did commission FSG, which they're a large nonprofit social impact firm, to develop the report. FSG is really well known for working in the philanthropy space with funders, as well as government agencies, and also like NGOs and other nonprofits. And they really went through kind of a three-phase process. The first was pulling secondary data, the things that exist out there, like the Behavioral Risk Factor Surveillance System, or the BRFIS, census data, county health rankings, even United Way's ALICE report. And they took a lot of those and synthesized them. Then they also held community dialogues across the state. They held dialogues in Nampa, Worley, and Wilder. And then they also held interviews with key stakeholders across the state. They held interviews with 21 individuals, and they interviewed the following individuals. So is everyone from the governor down to the head department agencies, to legislators, to key CEOs and presidents at some of the housing, working with the Latino community. So really getting their emphasis of where do they see, what are they seeing around social determinants of health? Where do they feel are priorities? Where are their topic areas? So it's a pretty robust interview group that FSG met with. Now, timing on this. We did start this in January last year and had the interviews wrapped up by end of February, so right before COVID really took off. Now, I have to say we had a lot of reflection around the report, and I actually think everything that was found in the report aligns exactly with what we saw during COVID. COVID almost shined a light on all of the findings that this report emphasized or displays, and maybe even exacerbated or accelerated some of them. And I'll talk about that. I think that was something that, as we brought some of these groups back together that helped develop the opportunities, that's really what we talked about, is this report's probably more relevant now than ever because of COVID. So while this report started a year ago, it couldn't be more relevant to everything that's happening and that we're seeing. So what were some of the findings? FSG actually broke it down then by the different social determinants of health and pulled that secondary data, pulled the interviews and the community dialogues to kind of see what's happening across our state. So what about an economic stability? What were some of the key findings? So Idaho is enjoying a very strong and steady economic growth. We've all seen this, we can all agree with that. But the thing that we're seeing is many Idahoans are still struggling to cover basic needs. It's the Alice report that says 40% of Idaho families cannot afford basic needs like housing, food, childcare, transportation, and healthcare. That has definitely become more exacerbated with COVID. The other thing the report found was persons of color and single parent households are more likely to experience financial strain. And one of the statistics that as a female is kind of hard to swallow is that Idaho ranks third worst in the state, in the nation, for women's employment and earnings, which is, as a working mom and a woman, that's still, it's hard for me to swallow that, of the Idaho sitting down there. And I think the thing that we're seeing, that all of us, I think, see in our work, is that families are foregoing so many basic needs, such as food, transportation, medical care, and housing, which ends up impacting their health, right? These are the things at the top of the cliff that are exacerbating how quickly they're falling off, right? But when they get there at the bottom of the cliff, a lot of them don't have access to healthcare or can't afford healthcare, right? And I love this quote that we saw. This was actually from the NAMPA dialogue. If we can move the needle for the worse off families, the rising tide lifts all boats. Communities will win, the economy will win, and Idaho will win. What about education? Preparing young Idahoans for lifelong success. Is what we found is from a very young age, Idaho's children are not having the educational experiences they need for lifelong success. Half of Idaho's incoming kindergartners aren't prepared to succeed in school, which goes back to needing even a robust pre-K and quality childcare system that gives those students the need, because you can see one of the stats is more than half of Idaho's kids younger than 6 years old live in a household where both parents work. That's a reality, it's a fact, and we need to create the system that allows those kids to thrive and to be ready for kindergarten, right? Not just the ones that need quality childcare, but all of Idaho's pre-K kids. Idaho's underfunded and underperforming K through 12 education system leaves many behind. And I'll actually show you the next slide that shows those educational gaps that are existing among some of our populations across Idaho. And as we know, post-secondary credentials are becoming increasingly important, and we can remove the barriers to help bolster our state's workforce. So when we look at this, who is getting left behind in Idaho? These are some of the math and ELA ISAT scores from 2019. And you can see that there's definitely differences in educational attainment, the scoring, based on these things. And I think this, I mean, I've been talking to school leaders all across the state post-COVID, and their top concern is the educational loss among students that were already behind. And so I don't want to see this figure post-COVID, because I bet you I'm a gambling person, and I'm taking the gamble that this has become more exacerbated. This educational gap that exists. The other piece that I hear schools talking about, which relates coming up to the next topic, is youth emotional well-being. Those are becoming schools' top 2 priorities. How are we going to deal with this educational gap, especially among key students, and youth well-being, youth emotional well-being? So I know there's been some discussion and even some articles and media around Idaho's Latino students and the educational inequities and disparities that exist among the Latino students. Social and community context. I think this is the social determinant of health that's a little squishy. It's kind of hard sometimes, I think, to wrap our brains around. But what is our culture and our social fabric that promote the well-being? That's what we mean by social and community context, right? I almost think of it as the cultural piece and the social fabric pieces that are happening that impact health and well-being. So overall, Idaho felt at this time like we had a strong social fabric where people felt connected and supported. I can tell you right now, I've been talking to lots of communities, and one of the top concerns of communities is the community divide that exists. I think that as I'm talking more and more, the things that occurred during this last year, there is such a divide and divisiveness in communities that it's a really big concern of how do we come back together. And I so much applaud Idaho Community Foundation for their recent Project Neighborly grants. They're focused on how do we build that social connection again back in our communities. Because I see people, especially in some of our rural partners, where these people were friends. They used to go to each other's barbecues, their kids played baseball together, and they attacked each other publicly. There was bullying, there was name calling going on over this last year, and these communities are frayed and divided. And I say any elected official, probably 90% of every elected official that I've talked to in rural communities has said that the community divide and divisiveness is a top concern of theirs right now. And I think the other thing that report found is that there are many populations that feel left out. Latino, Native American, refugee, LGBTQ, rural, low-income families that don't always feel included. And the last bullet point up here is Idaho's current and future competitiveness is dependent on our relationship with each other. That is the success of any business. It is the trust and relationships and the context that make not only a business successful, but a state successful. So one piece in social and community context is something called ACEs, or Adverse Childhood Experiences. And there was actually lots of studies done, and it's really become a big buzzword. So ACEs are a whole host of things that can happen in a childhood, in a child's childhood, that actually has been found to impact their health. This is things such as growing up in poverty, separation or divorce, household mental illness, household substance abuse, family member in jail, witnessing domestic violence, neighborhood violence, death of a parent. And it's really fascinating because Idaho actually just started looking at this several years ago through the Behavioral Risk Factor Surveillance System, or the BRFIS, to get an idea of where is Idaho, how many ACEs are we experiencing? And we can see in some of these areas, Idaho is significantly higher than the rest of the United States. And some of these aren't all that surprising, like poverty and low income. But these pieces end up impacting and exacerbating the speed of the cliff, right? So these are things that happen at the top of the cliff and hugely impact what happens at the bottom of the cliff. These are the things that happen out in our communities and socially. These are our community context, right, that impact that bottom of the cliff. Neighborhood and built environment. This is how the physical environments impact health, so where we live. And what we're finding is Idaho actually has a lot of benefits, right? We have all this outdoors, we have more recreational opportunities than many other places, but we're still seeing that in some ways our neighborhoods and environments support health and can negatively impact our health. For example, in some rural counties, more than half of the low-income residents don't have a nearby grocery store. So if you don't have the environment to either be physically active or access healthy foods, you're less likely, right, to do those things. And I think the thing in built environment that we're seeing get exacerbated extremely quickly is that population growth is increasing our challenges related to housing, transportation, and access to healthy food. I think affordable housing now more than ever, it used to be, I heard a lot of communities say, it felt like it used to be a Treasure Valley dialogue. Now it's a statewide dialogue. And this isn't just affordable housing. In a lot of communities, it's any housing just doesn't exist, right? There is no available housing. So I love this quote that came from Charlene Marr, who's president and CEO of Blue Cross of Idaho. This growth itself is bringing people to the table to have conversations that in the past we didn't have, and now we have to. And we have to figure out how to work together. And a lot of this growth is bringing attention to these issues. And how do we manage this moving forward? And again, create a thriving, resilient Idaho. Access to healthcare. The last social determinants of health. So we know that access to health services is essential to the well-being of Idahoans, right? This is the bottom of the cliff, or the pieces heading down to the cliff, right? And the thing I think many of us on the call know, Idaho is a shortage state when it comes to primary care and behavioral health services. All of Idaho's 44 counties are considered a mental health professional shortage area. And this, again, has only exacerbated during COVID. We're seeing a lot of things happen with the behavioral health field right now. Either they're completely tapped out, they have so much need and so many people coming to them, which is amazing, but they don't have the bandwidth. They can't take on any more new clients. They can't take on anybody else. And we're also seeing a lot of attrition. I've been having a lot of dialogues with the federally qualified health centers across the state, and some of them are struggling because of what the behavioral health providers are hearing and seeing. It is absolutely draining on them, and they're leaving the field. And we know that when we don't have access to care, behavioral health or primary care, this is only going to exacerbate what's happening down there at the bottom of the cliff, or speed up more things coming off the cliff, right? And it's really important that we focus on the bottom of the cliff, but we also have to be thinking of those upstream or the top of the cliff things. They're the ultimate causes to needing the bottom of the cliff, right? Okay, so those were kind of the findings. What was the call to action? So the call to action was actually crafted by around 20 organizations. Idaho Community Foundation was involved in that. They looked at this data, they talked about it, and said, what can we do? What does this look like? What are the opportunities that exist in Idaho? And the first call to action was cross-sector collaboration. That if we're going to create a vibrant, thriving, resilient Idaho, we need to work collectively to address the social determinants of health and ensure that no one's left behind. And to work collectively, it has to be that cross-sector partnership, because no one organization can create this future. We're going to have to align resources, strategies, and goals to impact Idaho. And there's a great quote out there that I love that says, when spider webs unite, they can tie up a lion. If we each keep acting as individual spider webs, we're not going to get anywhere. We're going to have to work collectively together. And I know that's very easy to say and very challenging to do. And if we're going to address the social determinants of health, this is the blue box, we have to address them holistically and not as siloed, because they are so interconnected. It is those cogs, right? You can't move the education cog without impacting the economic stability cog, right? So they are all interconnected, and we can't treat them as silos. We have to treat them holistically, right? And to do that, again, it takes a whole bunch of different organizations thinking about this. And I'll be honest, I don't know if all the key stakeholders across our state understand the interconnectedness of this, of how education is connected to the criminal justice system, and it's impacted by the economics, right? And I think there's a lot of educational opportunities that all of us can even do on the call about how these are so interconnected, right? And we need to make sure that you understand that if you move this cog over here, it is going to impact this one over here. And where are we putting time and resources, and which cogs are we impacting, right? And ensure that no one is left behind. I think that this is one that we're seeing right now more than ever and getting talked about more than ever. But as Idaho, we will need to overcome geographical and cultural divides, right? I'll be honest, I'm from Boise. I even live in the north end of Boise. And if I leave Boise and go to our rural neighborhood, like many of our communities, I need to stop and listen, because they automatically go, oh, aren't you cute? You're from Boise, you don't understand us. And you're right. I need to take a step back and listen and understand that community, understand its assets, right? And we also have to listen and learn from each other. And like I said, right now, what I hear more than anything from communities is we are so divided. We're so divided. It's going to be a tough one. So what were the opportunities that got identified? There was actually 3 of them that got called out. The first one was fostering community capacity. So if we're going to address the social determinants of health, we're going to need to give local communities and at the community level the skills and capabilities to look at the social determinants of health and address them interconnectedly, right? So it's going to be engaging a diverse group of stakeholders across communities, helping to create shared visions in communities, helping them create the structure, mobilizing resources, that's even across our state with funders, and building the feedback loops that continually allow communities to look at where are we going, what do we need, right? And I think we have to listen to communities continually, right? I know Idaho Community Foundation does this. You know, they did their dialogues, came up with their new focus areas of we can't sit in an office and think we know what communities need. We have to listen and then help them find the solutions and give them the skills and resources to create their solutions. The second strategic opportunity was connecting health and human services. If we're going to address social determinants of health, we have to start connecting all of the different services to make this happen. We can't be treating as silos. So schools, community centers, hospitals, apartments, housing, everything needs to start to be working more integrated together and move from these silos, because health doesn't happen in a clinic. Health doesn't happen in the doctor's office, right? Health is happening up at the top of that cliff that's going to start with our schools, within our communities, right? So how do we start to integrate and connect all these pieces to work more holistically together? The third strategic opportunity was to align public policy to promote health and well-being. And this is really thinking of health in all policies, and even how do we start to think of the bottom of the cliff to impact policies at the top of the cliff, right? And I think the thing is, I went back and I talked to a lot of the initial interviewees, those 21, and presented these findings to them and got their feedback. I talked to Idaho Community Foundation, I talked to a whole bunch of people, and the resounding theme was where we have the most momentum around this is in the local communities. It's starting at the grassroots and having this happen within our local communities and helping them do this to bubble up and create kind of that tipping point or that momentum in our state. But the way culturally in Idaho, some of the top down sometimes is not always as effective as starting with the bottom up. Ooh, I'm doing good on time. So I'm always an optimist. I'm an Idaho native. I love this state. I'm also a boomeranger, right? So I moved away, I came back, and I think we can do this. I think together we can create a vibrant, thriving, resilient Idaho. It's going to take a hell of a lot of work, and it's going to be hard. I think together, if the spider webs can unite, we can do this. And I'm an optimist. I know it's hard, but I think we can. So that's kind of the end of the report of where it is. This is available on our website. And I can also send, if you want a hard copy of it, you can be downloaded from there. But I'd love to hear your thoughts and questions, either for myself or Idaho Community Foundation.
Wow, Kendra, thank you so much. That was awesome information. If you want to stop sharing screen, we can then pull up everyone. So we're actually a relatively small group. So if you're comfortable, feel free to go off mic and ask a question or just throw it in the chat function.
Well, I'll ask a question. First, Kendra, my name is Stephen Wigg. I'm on the ICF board and chair Idaho's Health Insurance Exchange. Have a long career in this. The stuff you've done is just absolutely spot on. I mean, we've known for a long time that education and income have a huge impact on health status. And if we really want better health, let's get better education and better income. One thing I noticed public policy wise was this state has not really done a great job in that area. We saw a challenge this year in terms of getting the early childhood grant money reintroduced. So while everything you had was great, one of the missing pieces is funding for education, funding for some health care. This is a long haul work in progress. But I applaud Blue Cross for doing this. And I think we need to figure out the partnerships to keep this moving forward.
Yeah, thanks, Stephen. I couldn't agree more.
What other questions do people have or reactions to this report that Kendra shared with us today?
Well, this is Stephanie. I'll chime in and kind of follow up on Stephen's comments about the need to start early and provide those supports for families. And the libraries have just done a really interesting, how libraries are social well-being centers for many of our rural communities. But I'm wondering, Kendra, what your thoughts are on how we can, as a state or community by community, get that support from stakeholders for starting out early and providing those funding and resources for families who are struggling right now.
Yeah, Stephanie, that's so great. And it's so good to see you on this call. Stephanie and I are actually working on a really cool project right now of telehealth in rural libraries, by the way. We're getting ready to roll that out, something we've been working on for a couple months. So it's good to see you on the call. I think as I've been having more dialogues around this report, the theme that keeps emerging, and I think Stephen even just said this, how do we work better together to deliver this messaging and the type of messaging and the language that even gets used that starts to move the needle? And I think it's sitting down and working very collectively together of how things get worded. And I think even the educational pieces, because like I said, I think the thing that I heard too is not everyone understands the cog on the wheels, right? And I think if there's an opportunity for us to craft that language and craft that collectively together to where all of us can start talking about that, like, you know, we actually do need to invest here. And if we move that cog, here's the other cogs that can get impacted. I think that's what I'm hearing and seeing. And I'd love to open it up if others are hearing and seeing other things related to that or have other thoughts to Stephanie's questions.
Would anyone like to respond?
I would love to share a comment, and I agree. I'm so excited to see Stephanie participating, but also to hear about that collaboration. I believe that libraries are a really important partner because of the trust they do have in local communities and serve as a really great place for convening people. So, you know, I think there are other organizations like that throughout our communities that are not necessarily the natural partners because they aren't providing a direct service, but can help with this idea of collaboration that the report and Kendra talked about. So I look forward to thinking about ways we can identify those partners and communities, and welcome all of you to share your thoughts on that as well.
You know,
Well, and honestly, sorry, go ahead, Stephen.
I was just going to say just a couple of thoughts. One is, I think one of the a base starting point for me is that in my experience, almost every parent of a young child wants that child to succeed. And let's start with that point and moving forward. And B, what we do with children from zero, actually from in the womb to 5, is so absolutely critical. And what we can do there can make a huge difference going forward. And so these social determinants, two parents are working. They're struggling to live paycheck to paycheck. They don't have good internet access. They don't have a Chromebook. And the kid goes to school not ready to learn. It's a setup for failure. And so I think putting the focus and looking at how those pieces fit together and talking about that in a way that can resonate with policymakers is critically important. I mean, I've been at this for a long time. You can see, unfortunately in healthcare, people make their money because we get sick. You don't make your money by helping us stay well. And I know Blue Cross does better when you don't have to pay all the claims. But unfortunately, the healthcare industry in our country, and I've been part of it, makes their money off accidents and surgeries and everything else. But what we really need if we're looking at a functional society is what are all the tools that can help every parent of a very young child succeed? And how do we partner in a community? And I think some of the things that have started, it's really good. We just need to make that much bigger. And how do we partner to do it?
Thank you, Stephen. Would anyone like to respond to any of the comments or questions or thoughts that have been shared today?
Well, as I listen to this whole conversation, I just keep thinking about our legislators and how do they fit into this picture, and have they heard this presentation?
I have not given this presentation to them yet. I would love to. But yeah, and I think the thing that keeps coming up, and Karen knows we've been involved, we've been having some dialogues about this, is again, I think with the legislators, it's being very coordinated and working together and finding the right terms and examples and things to use that advance this work, not send it backwards, right? And I think we definitely saw some examples of things going backwards versus, I think, how can we work together and very strategically to build the right momentum to move this forward. But I would love the opportunity to talk to legislators more about this. And I mean, I have a former legislator on my board who's kind of, I mean, he was the one who said, I don't know if all of them understand this, to understand the interconnectedness of it.
So thank you, Jamie. For those joining by phone, we had a comment in the chat. Jamie says, I just want to add that thinking outside the box in terms of partnership can be incredibly valuable and rewarding. We are a conservation group and not generally thought of in the health realm, but we have access to land, to outdoor recreational and wellness opportunities, etc. I think creativity will be key to filling in the gaps and creating solutions that benefit the community. Thanks for sharing that, Jamie. I think that that's a really important point to make is, we have a lot of opportunities for outside the box and higher level strategic thinking, collaboration, and creativity. So that's a great example. I'd like to know, I'm going to toss out there and ask folks to answer in the chat or come off mic again, but I'm curious to know what resonates with you about what Kendra shared with us today. And please do answer, because this will help us as we continue to shape out the rest of our virtual education curriculum throughout the year.
This is Stephanie again. I think the vision of creating a vibrant, thriving state, I just think, that's what we can rally around. Governor Little's, vision for the state, I think is especially for our native Idahoans who live here and want to see our state thrive and do that. And those visions are out there. So it's just getting those other partnerships better established and building on successes. And it is disappointing to have some of those setbacks and thinking of ways that we can overcome those.
Oh, Stephanie, you accidentally muted.
Sorry about that. But the research that's been done and the study that you put in there, I thought it's a fabulous piece, and just getting more eyeballs to read those, to hear the message, and I think it's terrific.
Thank you, Stephanie. And then also, Nick echoes a similar sentiment. It takes all of our organizations to make a difference, but we need to be on the same page and work together. And then Jamie also shares that this touches everyone, every community in Idaho, every facet of our communities. We're not off the hook if we live in an affluent or more educated community, or however we may typically exclude ourselves from these uncomfortable conversations. So, very good points and very good dialogue. Is there any other questions or thoughts that folks on the call today would like to share or ask Kendra?
This is Randy Jensen. I'm the superintendent of the American Falls School District. And I just want to just say what she's saying is right on. And I just to give you an example, about 3 years ago as a school district, one of our goals was to try to engage family development specialists.
Randy, unfortunately, I think we might be having a problem with your sound. So I might recommend that maybe if you could just quickly type your thoughts into the chat so that we can share them, that would be really helpful, because I know that we want to hear what you're saying.
Okay, thank you. I'm sorry.
No, no problem. It is our current world. Anyone else? Thank you. Shay just shared, it's easy to become myopic in working in our own areas. It was a reminder that we're all interconnected and can help pull each other up. Yes, absolutely. Thank you for sharing that. All right, I'd like to just offer one more opportunity and really encourage folks to speak up or in the chat. Stephen says getting the health districts involved in this initiative is critical. A suggestion, try putting together some focused community forums, including local legislators and chambers and school superintendents. We appreciate that there was a lot of interest in this conversation and this topic today. So stay tuned as we look towards some future educational opportunities and perhaps maybe follow up on some of the threads that came up in our discussion today after Kendra's presentation around collaboration, community interconnectedness, and opportunities for involvement overall. So Kendra, I want to say a huge thank you on behalf of not only the Idaho Community Foundation, but all of our friends and partners on the call today. It was fantastic and a great way, I think, to help us shape our thinking as we continue on into 2021. So reminder, we will be in the next couple of weeks sharing out a recording as well as Kendra's slides. And you can feel free to reach out directly to me if you have any questions or would like some further follow-up, and I'm happy to help coordinate that. So with that, thank you so much, everyone. Be well, and we'll be in touch soon.